The role of EHRs in coordinated care, integration with lab, imaging, and pharmacy systems, integration with laboratory systems, real-time lab results. EHRs are integrated with laboratory systems to automatically receive and update lab test results. This integration eliminates the need for manual entry and reduces the chances of errors or delays in reporting test results. Clinical decision support. By integrating lab results directly into the patient's record, EHRs enable clinical decision support tools, CDS, to analyze lab values in real time. Alerts for abnormal results or clinical guidelines for interpreting test results can be automatically triggered. Faster turnaround time. Integrated lab results mean that healthcare providers can access the most up-to-date information immediately, improving the speed of decision-making and reducing wait times for both clinicians and patients. Integration with imaging systems. Access to radiology, reports, and images. EHRs integrated with radiology systems allow healthcare providers to view imaging reports, e.g., X-rays, MRIs, CT scans, directly within the patient's medical record. Imaging systems, like picture archiving and communication systems, PACS, can feed diagnostic images into the EHR, enabling quicker consultations and better informed decisions. Reduced duplication of tests. Integrating imaging results with EHRs helps avoid redundant imaging tests by providing a comprehensive history of previous scans and diagnostic images. This not only saves costs, but also prevents unnecessary radiation exposure to patients. Improved collaboration. Physicians, specialists, and radiologists can access the same imaging information, enhancing collaboration and facilitating more accurate diagnoses and treatment planning. Integration with pharmacy systems, medication orders, and management. EHRs integrated with pharmacy systems streamline the prescribing process by automatically generating medication orders that can be sent to the pharmacy electronically. This reduces medication errors such as incorrect dosages or drug interactions by using decision support tools embedded in the system. Real-time medication monitoring. Integration allows for real-time monitoring of a patient's medication history, reducing the risk of adverse drug reactions, ensuring that prescriptions are filled appropriately, and allowing providers to track compliance. Refill management. EHRs with integrated pharmacy systems also streamline medication refills and ensure that prescriptions are updated automatically, reducing the time spent on manual follow-ups. Interoperability standards, HL7, FHIR, and data exchange mechanisms. Interoperability is essential for achieving seamless data exchange between different EHR systems, labs, pharmacies, imaging centers, and other healthcare entities. To ensure that patient data is transferred accurately and consistently, certain interoperability standards and data exchange protocols are used. HL7, Health Level 7. HL7 is a widely adopted set of standards for the electronic exchange of health information. It specifies the formats for messages exchanged between healthcare systems, ensuring that the data can be understood by different software platforms. HL7 v2.x. The most common version of HL7, used for sending clinical and administrative messages between systems. It supports data exchange related to patient admissions, discharges, transfers, orders, and test results. HL7, V3, and CDA, Clinical Document Architecture. More recent versions of HL7 designed to enable more comprehensive document exchange, CDA, in particular, is used to standardize clinical documents like discharge summaries and progress notes. FHIR, Fast Healthcare Interoperability Resources. FHIR is a modern interoperability standard developed by HL7, which is designed to provide fast and flexible data exchange across healthcare systems. FHIR uses web-based technologies, including RESTful APIs, which allow real-time access to healthcare data across platforms. FHIR's modular approach. It organizes healthcare data into smaller resources, e.g., patient demographics, diagnostic reports, medications, which can be exchanged independently. This modularity allows for better scalability and flexibility in implementing integrations. FHIR benefits. The standard is more flexible, lightweight, and developer-friendly compared to older standards like HL7 v2. It supports mobile health applications and cloud-based platforms, making it ideal for modern, interconnected healthcare ecosystems. Data exchange mechanisms, APIs, application programming interfaces. APIs are increasingly used in healthcare to connect EHR systems with external platforms, such as health information exchanges, HIEs, insurance companies, or public health registries. APIs allow for the secure and real-time exchange of patient data between systems. Direct messaging, a secure email-based messaging system that allows healthcare providers to send encrypted patient data, such as test results or discharge summaries, between organizations, ensuring confidentiality and compliance with regulations like HIPAA. Health information exchanges, HIES, allow healthcare organizations to securely share patient data across institutions and locations, enabling a more complete picture of a patient's health history. Through HIEs, EHRs can exchange information such as medication lists, lab results, or clinical notes, improving care continuity and reducing duplicate testing. Facilitating care transitions, sharing EHRs between providers and institutions, coordination of care across multiple providers. Care transitions occur when a patient moves between different healthcare settings, e.g., from hospital to primary care or from one specialist to another. EHR integration helps ensure that all involved providers have access to the patient's complete health history, medication list, and treatment plans, leading to smoother transitions and better informed care decisions. Discharge summaries. EHRs facilitate the creation of discharge summaries that can be easily shared with the next healthcare provider, detailing the patient's condition, treatments administered, and follow-up care instructions. This ensures that patients receive continuous care without gaps in information. Patient referral and consultation. When a healthcare provider refers a patient to a specialist or another healthcare institution, EHR integration enables the easy transfer of essential patient information, including medical history, diagnostic results, and treatment records. This enables the specialist to make informed decisions based on a complete picture of the patient's health. Referral tracking, EHR. Systems can track referrals and ensure that follow-up appointments and tests are scheduled, helping providers monitor and coordinate care post-referral. Cross-institutional data sharing. Healthcare institutions, such as hospitals, outpatient clinics, and pharmacies, often need to exchange patient information to provide continuous care. EHR integration supports this data sharing, ensuring that all providers are on the same page regarding the patient's condition, treatment plans, and history. Legal and regulatory compliance. Secure and standardized data sharing ensures that the privacy and security of patient information are maintained according to regulations like HIPAA, Health Insurance Portability and Accountability Act, in the U.S. or GDPR, General Data Protection Regulation, in the EU. Legal and regulatory aspects of EHRs. The use of electronic health records, EHRs, is governed by a complex set of legal and regulatory frameworks designed to ensure the privacy, security, and proper management of patient data. These regulations are critical to maintaining the trust of patients, protecting sensitive health information, and ensuring healthcare providers comply with national and international laws.